They are often the unsung heroes of medicine. They plan, they implement, and they evaluate health care. They are nurses. Through the years, their skills and responsibilities have grown to encompass so much. Tonight, we celebrate this challenging profession with 3 generations of nurses, all from the same Houston family, that of Dr. Denton Cooley. Join us as we look at the challenging and changing roles of nurses and how, with the rising cost of health care, the medical profession depends on them more and more. I'm Ernie Manous, and this is Houston8. Joining us tonight are Dr. Susan M. Cooley, pediatric nurse practitioner and vice president for Clinical Services, Ready Clinic. Mary Plum Senkel, an emergency room nurse at Memorial Hermann Hospital. And Nurse Louise Cooley, former head nurse on the surgical floor at Johns Hopkins Hospital, and she just happens to be married to heart surgeon Dr. Denton Cooley. Before we start, remember you can share your thoughts throughout the evening by using Twitter and using hashtag Houston8. So welcome to all of you, and thank you for joining us.
Thank you.
I'm going to start with Mary and ask, what influenced you to want to become a nurse?
Well, I think growing up, I spent a lot of time with my mother in clinics. And at first, when I went to college at the University of Texas, nursing wasn't on my mind at all. I became an art history major and actually graduated with that major. And about my senior year, I decided probably didn't see myself in a museum or isolated in a gallery somewhere. I kind of wanted to work with people more. So thinking about, all the experiences I had, growing up with my mom, thought, I should probably think about nursing.
Yeah.
So I started some pre-nursing classes. That was my junior year, actually, of college, and ended up applying the next year to nursing school. And actually, I graduated with a BA in art history on a Friday and started nursing school that Monday.
Okay, Susan, same question.
It was a busy weekend.
Yeah, there's a lot of shifting going on.
Actually, I have kind of a different path. Because I was kind of a hippie growing up, the last thing I wanted was to do something like my parents. And as it was coming time to declare a major, I really liked the nursing building on the UT campus. It looked like an old Army barracks, and I had envisioned myself in the Peace Corps or some kind of a world traveler. I love to take photographs, and I thought, maybe I'm going to go to nursing school so that I can travel and get away and see the world. So that was really my motivation.
And of course, Louise, the same question comes to you. What encouraged you or inspired you to become a nurse?
Well, actually, my father was a doctor in Maryland. I graduated from William and Mary College, and then what was I going to do? So I decided nursing was the best thing, and off I went to Johns Hopkins in 1947.
So how different do you all feel that the path to become a nurse was for each of you? And when I mean the path, I mean the education that it took to take on the title nurse.
It's not easy. You have to have science, and it really took 4 years to be graduate nurse at Hopkins.
Was it the same for you, Susan?
Well, I think it's important to have a strong liberal arts background at the basis of all education, because it makes you more human and kind of better at the bedside. I think each one of our paths was a little bit different. I went straight into nursing school as an undergraduate. My mother graduated with a degree in psychology and then went to a certificate program. And Mary graduated with a BFA and then got a second bachelor's degree. And Mary is actually now in a master's program where she's becoming a nurse practitioner with a focus in emergency room.
And there's a good spot to go to, is the different classifications of nurses. And nurse practitioner, I was unfamiliar with that until probably the mid-90s that I started hearing that term. Explain to me a little bit about how this has grown up and what is a nurse practitioner exactly.
Shall I take that one?
Definitely.
Well, a nurse practitioner is an advanced practice role. At the core, we're all nurses. Our basic training is in nursing.
Which, just before we go further, explain what that means. Because I think a lot of people think, well, that's a doctor's assistant.
Well, actually, physician and nurse are two distinct professions and have two distinct roles in patient care. Physicians treat the illness. Nurses treat the human response to the illness. So, if you look at how nurses and physicians practice together, the illness may not change minute to minute. So a physician can come in and change the dosage, operate, do things like that, whereas the human response is there 24/7. That's why you need to have a nurse at the bedside 24/7 dealing with that human response. So we are on parallel paths and we are part of the same team.
Okay, so, and I cut you off when you were talking about taking me through to a nurse practitioner.
So sometimes, as a nurse practitioner, nurse practitioners are trained basically in basic nursing and then go on to get advanced training so that we can be there, especially geared towards primary care. So many of the things that a physician traditionally did can just as easily be done by a different professional.
And a nurse practitioner can write prescriptions now and things like that,
yes.
too, correct?
Nurse practitioners can do many procedures, can write prescriptions. Unfortunately, Texas has the most stringent oversight requirements of any state in the country, but that's a different story, meaning that we have to have oversight by physicians. But in the past, nurses were at the bedside 24/7, and when I say the bedside, I mean in a clinic or wherever the patient is. So nurses really were providing those types of services, and this nurse practitioner training formalized that.
Yeah. Mary, so if you're going to go to school to become a nurse practitioner, and I don't mean any disrespect, why not become a doctor? Why go the nursing route instead of the doctor route?
You know, I think I was more geared towards patient care in the first place, and that's why I chose nursing, because I wanted to be at the bedside. I saw myself more hands-on and providing that comfort and care. And then, you know, I decided to advance my degree and to be able to be a nurse practitioner because I wanted to be in an environment that I'm doing a family nurse practitioner degree, which means I can provide primary care. And I see myself more in that role rather than, I think, you know, to become a physician, you'd see yourself more in a critical care role, more of a, you know, there's different avenues, of course, and you can do primary care. There's such a need for primary care doctors and nurse practitioners and PAs that I felt like that was the best avenue to go down. Mm-hmm. And, you know, I think to go back to medical school now would just defeat the purpose.
Right. And Mrs. Cooley, how have you seen the job of nurse change over your career?
Well, there have been so many changes since my day, actually, although the basics are there. But now there's so much technology, and nursing is much more complicated today, I think.
Yeah.
It's just many, many changes.
What was the joy you found in doing your job?
Well, at first, when I became head nurse, I was a head nurse on a male surgical floor. It was just post-war, and there weren't many orderlies or many nurses, actually. It was just quite a challenge. It just never entered my head to do anything else.
Yeah. We often see the image of, there are different images of nurses that are in media. And when you say a head nurse, we think of a rough, tough person. Is it very challenging to be a head nurse, especially when you're over a floor that has a lot of male egos that you're kind of supervising?
No, not really, because you're in charge of the nurses on your floor. That's what it is, a head nurse. But
you are coming up against a lot of doctors and their opinions of how things should be done.
No, not really.
No?
We, in our day, respected the doctors. We were all called by our last names. We were not called first names. And we went around with the doctors on their rounds and took their orders. It was just a very respectful situation between the nurses and the doctors. Maybe today it is a little different, I'm not sure. But in my day, that's the way it was.
Susan, is it different
today? There were
today?
no problems.
Well, it's important to remember that healthcare is a collaborative sport, and it's not nurse or doctor, it's both and. Right. So we have to work together, and our common goal is to help the patient get better, help the patient move out of the hospital or the healthcare system so that that patient can function appropriately in the community, and we work together for the patient.
Is it hard to challenge, though, concepts in popular culture of what a nurse is? Do we get it wrong?
I think sometimes it's wrong in popular media, television shows, but I think it's becoming more and more right. I think that as nurses become leaders, I think that the media and the world is getting it, that nurses really are well educated, nurses really are on the forefront of healthcare, and nurses are a big part of what makes healthcare run.
Well, it's interesting, you go back and look at the history of nursing, and you realize the advances that were made for women through the profession of nursing, even voting, that nurses got the right to vote. I think it was in Canada first because they were in the military, and so the military, ex-military got the rights to vote, and women because they were in it. And so that nursing really has been at the forefront of the women's movement, too.
Absolutely.
Yeah. I'm curious, too, when we talk about the new healthcare regulations that keep coming down and the changes in the way healthcare, do we see this as something that's going to affect nursing? Has it already affected nursing? I'll start with Mary on this.
I think that it will definitely affect nursing. There's no doubt.
Pro or con? What do you think?
Well, I think that there's a mix. I will say that, getting a nurse practitioner degree, I think that there will be more opportunities for nurse practitioners. And with, the Affordable Health Care Act and everything, that primary care is really going to become a focus. And it already needs to be, and there's such a need. And fewer physicians are going into primary care, that nurse practitioners are really going to be given, opportunities for work and expanding practice.
Mm-hmm. Do you feel that patients, and I mean no disrespect when I ask the question this way, but patients, I think, often feel shortchanged if they don't see the doctor. If they go and they see a nurse practitioner, in some way they feel like they're getting less care than they should be getting. I've worked with a lot of nurse practitioners and never feel that way in the experience. Actually, I see it the other way. At least you get the FaceTime with the nurse practitioner. But is that a problem, and how do you combat that?
I haven't seen that as a problem. Doing my clinical rotations, I'm doing my student nurse practitioner training, and I've been in a lot of clinics. And I find that patients are so receptive to nurse practitioners, and as they learn more about their role, I think that it really is, you get more time with the patient, and they really do appreciate that. And I think that we are getting to the point where we are treated with the same respect, and I think patients will respond to that and understand. Of course, I'm sure there are, situations where patients do feel shortchanged, but
right.
The amount of time and care, and especially our nursing training, has taught us so much to be hands-on with the patient and really listen to the patient and give them the time and the opportunity to really voice all their complaints and all their healthcare needs. And I think that they will respond to that positively.
Susan?
Well, patients really don't care that much about who the messenger is. What patients want is to feel respected, to feel heard, and to be treated appropriately so that a patient can have a positive or a negative experience with any provider.
Mm-hmm. What do you think with the changes in healthcare in today's changing economy? How is that altering the nursing profession?
Well, a couple of things to remember is that nursing is really the largest group of the healthcare workforce. There are many more nurses than there are physicians or any other healthcare professional. And then the second thing is that coming down the pike, even for big hospital systems, is the fact that it's a requirement that we address early diagnosis and treatment and prevention. And that's exactly what nurse practitioners are trained to do and to help with.
Before we started the show, we were talking a little bit about when people have their hands fisted up. And you were saying that when you walk through a ward, if you see a patient with their hand like this, that you open it up and relax it. And what I take from that story is the attention that nurses are giving to each individual patient, that it's something a doctor doesn't necessarily have the time or isn't there to notice necessarily. And it's that the constant time you have with the patient helps you to notice these different things. Anything you wanted to say on that?
Well, I spent 35 years teaching at UT Medical School, and I taught nurse practitioner students, pediatric residents, medical students, family practice residents. And one of the things that I taught them, which I think that many of them have taken away, is just those very things. If you see a patient whose hands are fisted, know that that patient might be under stress and consider opening it. So opening the hand. So what I would do is I would model that for my students. And I think any good teacher or any good professional will model appropriate behaviors, and then students, no matter whether they're a nursing student or a medical student, will take those activities away and maybe apply it to their own practice.
Mrs. Cooley, secrets, success stories that you know of that lead to a healthier, fuller life. What have you picked up through your career that people can take away?
Well, I do think that nursing is a noble profession, and it's also a good training for life. I think I learned a lot of things from a nurse's training.
Such as?
About running the family, things like that. For one thing, you always look ahead for what disaster might happen so you're prepared.
Yeah.
So that's one of the things. But also, nursing is just the same today as it was in my day, because the main purpose is to make the patient comfortable and safe and observe them. And that's the main purpose of nursing, aside from all the technology that they have today, which makes it much more complicated.
Now, as we mentioned at the beginning of the show, that you just happen to be married to a well-known doctor, Dr. Denton Cooley. I'm curious if the experiences you had having such a recognizable husband as a doctor, how did that work for you as a nurse? Was it a plus? Was it a negative?
Well, actually, I came from a doctor's family, so I was used to the hours and things like that, which never bothered me. But I really didn't work very long after I was married when I came to Houston, because I had my children then. So he was just the same person always, and he worked very hard hours, but he was always available for the children when they had their ballet lessons and things like that. It was never any problem to me.
Did it have an impact on either of your careers, do you think?
Well, in jest, he calls her Nurse Thomas, because his first relationship with her was when she was the head nurse on the surgical floor.
Halstead 5.
Halstead 5. And we've all taken our trips to go and see the place where they met. But Nurse Thomas has always been at the helm of our family, and I'm sure that made an impact on me, and I know it made an impact on Mary, all of my children, and all of the cousins, all of her children and grandchildren know this battle cry. Nurses training, it's training for life. It's something that she calls.
Now, we have 3 of you here. Are there other nurses in the family, or is this pretty much the sum total of Cooley nurses?
We have a physician. One of my sisters is an ophthalmologist. We have a medical illustrator. So she draws the pictures that are in the books, the medical books. And we have a sister who is married to a physician.
Yeah. Is it hard, though, to escape, if you'd want to, the name? I know oftentimes in a family where there's a very recognizable figure, and especially if you're in a similar career, that it becomes maybe, I don't know if burden's too strong a word, but that there is a certain perception already there.
Well, I can tell you a story about that, and it actually is a story that led to my calling. When I was a brand new nurse practitioner at UT Medical School, of course, I was one of the first nurse practitioners in Texas, and definitely the first at the nursing school, so they didn't really know what to do with me. So I was in the pediatric clinic, and because of my last name, medical students, residents, even faculty would come to me and asked me to listen to this heart or look at this EKG. And of course, I had no clue. I was a brand new graduate. And so I found myself trying to get farther and farther away from the medical center and ended up in a clinic now in Midtown Houston, but it was down in one of the barrios of Houston called the San Jose Clinic. And I found my passion, which was indigent care. And I spent years and years in the indigent clinics in the barrios, taking care of brand new immigrant Hispanic patients. And my motivation was really to get away from the people in the high-tech medical center who were asking me questions about hearts that I had no clue about.
Mary, any similar experiences for you?
You know, I feel mostly proud of where I come from and, you know, my grandfather's legacy. I find that, of course, it's hard that people do have preconceived notions about you if you do come from such, you know, a well-known medical family. And although I haven't had people ask me to look at EKGs or listen to hearts, you know, there is a part of me that I would like people to know me first as a nurse and then second as, you know, Dr. Cooley's granddaughter.
Well, now that you're married, you can kind of hide that a little bit more with a different last name. Now, all three of you are being honored coming up at the Partners Luncheon. And who can tell me a little bit about Partners and all the great work they do?
Well, I was part of the original Partners group. I believe it started in 1994, and I believe it was Peggy Barnett's brainchild. She was on the development board for UT Health, and Peggy and Pat Stark, the dean of the nursing school, got together and said, you know, we need to get the nursing school's name out, and we also need to promote nursing out in the community. So Partners provides scholarships for nursing students, and provides research grants for existing faculty and some endowed chairs in nursing, which then allows more nurses to graduate and improves the quality of the education that's done at UT Nursing School.
Are we having a problem getting women interested in being nurses in today's day and age?
Absolutely not. We have men and women knocking the doors down at UT and all of the nursing schools around the country. Our big problem is that there are not enough advanced trained nurses with advanced degrees to be the actual professors in the nursing schools. So if we can increase the number of professorships and the number of teachers, we can increase the numbers of students that we can allow in.
You mentioned male students, and it's interesting because through the research that I read, which I didn't expect to find, it is still very heavily slanted toward women, that it really hasn't.
But it is increasing.
It is.
And I don't know how many are in your class, but the statistics show that there are more and more men going into nursing now because it is such a needed profession, and there are jobs out there.
Yeah. Mary?
The question about male nurses?
Yeah.
You know, in my nursing school, I think for my bachelor's degree, there were 3 male nurses, and then now in my master's degree, I think there's 10. So
out of how many, roughly?
Out of 60.
Okay.
So I will say it's definitely getting more so that males do feel that there is opportunity for them in nursing. And it's a really great avenue to get into as a male into nursing. And I work in an emergency room, so we have lots of male nurses, I think just because of, you know, the nature of emergency medicine, that males would be more, you know, geared towards that. But even on nursing floors, and I think that there are definitely opportunities for males to get into nursing. Okay,
my guilty pleasure question, though, I need to know about it. Growing up, I always understood that depending on where you graduated from, you had different hats. Okay. Is that still the case anymore or not?
Let's give that to our mother. That is her favorite
That is one
topic.
of my big complaints about nursing today. I was told not to mention this, but I will mention it. In my day, we wore white uniforms, white stockings, white shoes, and our cap, which signified from which school we were from. Today, they wear scrubs. You cannot tell the nurse from the rest of the people. It's one of my biggest complaints. And at least they should wear their caps, I think, but they don't.
So when they still graduate, you still get your distinct hat from your different nursing schools, or no?
We don't get a hat anymore. We do get a pin from each nursing school.
Oh,
which
that's
is one
not
of
the same thing.
I know,
That's
but I will say that there is one company that we know of, K's Hats,
K's
Caps, that does still have the caps from each nursing school, and my mother and grandmother both gave me a cap when I graduated nursing school. So I do have my Johns Hopkins cap.
And I have my UT cap. We did, when I graduated in 72, I think, we still got our hats. And we did wear all white. We happened to wear white mini skirts, but we had on our white tights under them.
Well, Mrs. Cooley and I are going to get together, and we're going to fight to get the caps back on the nurses and get them in the white. I want to go so far as the little short capes, too.
Oh, I love them.
miss
They're
those.
cute.
Yeah. Now I'm coming off sounding really bad. Thank you so much. And the Partners Luncheon is when?
April 26th.
And congratulations to all of you for your honor of being honored there and all the work that you've done for all of us over the years. Thank you so much.
Thank you.
Thank you.
And for keeping the tradition and the profession alive. And that does it for us right now. Now, each week we invite you to visit our home online at houstonpbs.org/Houston8. There you can read about the guests, learn more about the topic, and even watch past episodes. Now, next week on Houston 8, a look at the Trayvon Martin case and the use of stand your ground laws in Florida, Texas, and across the country. That's next Friday night at 8 p.m. right here on Channel 8. And that does it for us tonight. Until next time, I'm Ernie Manous. Thank you for watching, and have a great week.